Hi, Dr. Harrison here, and today I want to discuss auto injuries. Auto injuries are one of the most common causes of neck pain and back pain that we see in our office. Either someone's been hit from the rear and maybe they suffered a whiplash injury to the neck, or they've been hit T-bone on the side and they've been shaken side to side. So we see all sorts of pain related to these types of accidents: neck pain, back pain, headaches, sometimes numbness, tingling. In severe rear end collisions, even the shoulder strap sometimes will cause shoulder problems as the patient goes forward and that shoulder gets torqued backwards. We see tears in the rotator cuff, we see tendonitis, all these different types of injuries. Well, today I want to just discuss a little bit about our procedure in the office, how we go about treating these patients, and typically what I recommend for them. So obviously when they come in, we're going to take a thorough history of the accident to find out, well, what was the mechanism that caused their neck pain, back pain, headaches, whatever their complaint might be. And then we're going to do a very thorough examination. Usually we're going to take a full set of x-rays if they haven't had them already at the emergency room or somewhere else. And we want to evaluate for ligament damage. We want to check for normal coupling or movement patterns in the spine. And I'm going to explain in detail why that's important in just a moment. But once we get those x-rays completed, we evaluate those. Obviously, we're ruling out fractures, anything dangerous that may be going on there. Once we've done all that, and we know that we're safe as far as the bone structure goes, typically we're talking about soft tissue injuries. So what is that? What is a soft tissue injury? Well, we can boil those down to really two categories. We have strains to the muscles, which are microscopic tears in the muscle tissue. And then we have sprains, which is microscopic tearing of ligament tissue. So typically a sprain strain, we're talking about torn muscles and ligaments in the neck or back. And then muscles tighten up to protect the area or splint. And that's where these muscle tension headaches many times will come into play. So this is really the most common thing that we see. Well, obviously when you tear muscles and ligaments, the body's going to go through its normal healing phases. The body's going to come in and lay down scar tissue to repair those tears in the muscles and ligaments. And that's good and it's bad. It's good because obviously they're torn and they need to be repaired. It's bad because the body's going to come in and just throw down that scar tissue, kind of like patchwork or quilt work, and that scar tissue is not elastic like the original tissue, and it doesn't heal in the same alignment as the original fibers. So you tend to lose flexibility and mobility. And the scar tissue tends to grow with more nerve endings in it, so it becomes hyper-irritable, and it tends to tug on the tissues around it. So when I'm treating my patients or recommending care, I'm concerned about three different things. Number one, I want to get them out of pain and make them feel comfortable as quickly as we can. Very, very important. Obviously, kind of goes without saying. That's usually what brings them in. They're like, "Doc, I'm hurting. I want to feel better." But my concern for them long-term are twofold. Number one, we want to get all the mobility back into the joints in the neck or back or wherever they were injured, maybe the shoulder, sometimes it might even be knees or ankles. But we need to get normal mobility back into the joints, because if we lose mobility in the joints, that's what leads to arthritic change over time. It sets that process in motion. So that's very, very important, obviously, for people long term. The third thing that I'm concerned about is that scar tissue we talked about a minute ago. If we do therapy and adjustments while they're going through their healing phases, it will help that tissue heal more in alignment with the original fibers so that we can maintain some elasticity and we can minimize the amount of scar tissue needed to repair those tears. So if we can minimize scar tissue, we can restore normal mobility, we give them the best long-term prognosis, where they're much less likely to develop arthritis in their spine down the road. And by down the road, we're talking 7 to 10 years. So it takes 7 to 10 years before these arthritic changes start to show up on an x-ray. And so the younger you are, the more important it is to rehabilitate these things correctly, because you're going to be around for 7, 10 years and maybe a long time beyond that. There's plenty of time for arthritis to set up in there. If you're 90 years old, we don't need to worry about that so much. We just focus on getting you out of pain and getting you comfortable. But again, the younger you are, very important to rehabilitate these things properly, especially in children. Typical healing time is anywhere from 90 days, maybe up as long as 180 days in a real severe one. But most of our patients are done with therapy in 90 days, maybe a little bit longer. I would say 80 to 90% of our patients fall into that category, and they're doing pretty well. Another thing I do want to mention, obviously very important, even if you have little pain or no pain, you need to get checked out after your accident. Why? Because I see people come into the office all the time who, I'll take it, they come in with neck pain that they say developed gradually over the last 5-10 years, something like that. I'll take an x-ray, we put it up, and lo and behold, they have moderate arthritis in the middle of their neck, and I'll ask them, what happened to your neck here 15 years ago, because I've gotten pretty good at gauging how long the process has been going on after looking at films for the last 25 years. And they'll say, oh, I had a little fender bender 15 years ago, and but it was my neck was a little sore, it wasn't that bad, and then it went away and I just went about my business. Well, now this is what you get 15 years later, because the mobility wasn't restored. They probably have some scar tissue in there, and that's why it's so important to rehab these. We can prevent that type of thing from happening. Another important reason to get checked right away, state of Florida has a 15-day, it's either 15 or 14-day guideline from the date of your accident to get checked. So you have that 2-week period roughly to get in and document any injuries you have. So very, very important to do that in order to have access to your benefits. If there is no neck pain and nothing develops, or we don't find anything on your exam, great. No harm, no foul. But if you don't get that done and say 3 weeks later you start developing neck pain and headaches, it's not going to be a coverable expense under your auto insurance. So very, very important to get in and get checked. I hope you found this information very helpful. If you've had a recent accident and you're before that 14-day period, or maybe you've been checked by someone already and they've documented your injuries and it's after the 14 days, anything documented we can help with, and I'd be happy to do that for you in the office. Our consultations are always free, so pick up the phone, call and schedule, and we'll sit down and see what we can do to help you with these ailments you have following your auto accident. Again, I hope you found this helpful, and I look forward to seeing you soon.